What happens to your body when you stop drinking alcohol? Hello everyone. Today, we're going to discuss a topic that many of us can relate to. What happens to your body when you stop drinking alcohol? Alcohol is a popular beverage enjoyed by many, but its consumption can have various negative effects on our health. So, let's dive into the consequences of quitting alcohol. Alcohol consumption can have a significant negative impact on health, as well as on happiness and family and work life. Therefore, limiting alcohol intake is essential nowadays. So what happens to your body when you stop drinking alcohol? Follow this video and let us show you the amazing benefits of quitting alcohol. What is sudden alcohol cessation? Drinking alcohol is sometimes a cultural norm, but drinking too much and for a long time can lead to addiction and dependence on alcohol. Alcohol addiction leads to many dangerous neurological and digestive complications. When you suddenly stop drinking alcohol, it can cause the patient to be restless, sleepless, have headaches, nausea, and even experience delirium tremens, which is manifested by confusion, hallucinations, or illusions. 1. Symptoms of alcohol withdrawal syndrome. Symptoms can appear as early as 6 hours after alcohol withdrawal. Depending on the stage of the alcohol withdrawal syndrome, patients may experience symptoms ranging from mild to severe, such as hand tremors, anxiety, irritability, insomnia, nausea, poor appetite, rapid heart rate, slightly elevated blood pressure, increased sweating, generalized tonic-clonic seizures. Severe cases may experience delirium tremens, manifested by confusion, hallucinations and illusions, insomnia, reversal of day and night rhythm, personality disorders, seizures, fever, increased heart rate, low blood pressure, sweating, thirst, skin wrinkles. The mortality rate is about 15% due to cardiovascular collapse, suicide, or attacks on others. 2. Levels of alcohol withdrawal syndrome. Level 1. Increased activity of the autonomic nervous system. Occurs after 6 to 12 hours in all patients with sudden alcohol withdrawal with symptoms of insomnia, tremors, restlessness, headache, rapid heart rate, and gastrointestinal disturbances, vomit, nausea, anorexia. Level 2. Hallucinations, usually visual, sometimes auditory, and tactile hallucinations. Appearing after half a day to 1 day with a frequency of 10-25% of patients. Level 3. Generalized seizures occur within 12-48 hours in 15% of people. 30% of patients will progress to stage 4. Level 4. Delirium tremens. The time of onset is after 2-5 days with a frequency of 5%. The mortality rate is about 15% with or without treatment. Some risk factors include age over 30, rapid heart rate, infection, history of seizures due to alcohol withdrawal or delirium, trauma, surgery. Alcohol also has long-term effects on the brain, acting as a sedative or depressant. In long-term addicts, the brain is almost constantly affected by the depressant effect of alcohol. Over time, the brain self-regulates chemicals to compensate for the effects of alcohol. This is the production of stimulant chemicals, such as serotonin or norepinephrine related to adrenaline in greater amounts than normal. If you quit alcohol suddenly due to withdrawal, the brain is like a car driving fast without brakes. Most of the symptoms of alcohol withdrawal are due to overstimulation of the brain. The most dangerous clinical manifestation that occurs in a 20th people who withdraw is delirium tremens, when the brain can no longer regulate chemicals when alcohol is stopped. Delirium tremens is a temporary state of confusion, in which the brain can no longer control many things such as circulation and breathing. Vital signs such as heart rate and blood pressure change very suddenly and unpredictably, leading to heart failure, stroke, and death. Therefore, it takes a long time for the brain to adjust to the habit of drinking alcohol, helping the brain to regain balance. What happens to your body when you stop drinking alcohol? 1. You may avoid accidents. Alcohol plays a role in at least half of all serious injuries and deaths from burns, drowning, and homicide. It's also linked to 4 out of 10 fatal falls and car crashes, as well as suicides. Even cutting back by a third can reduce your injuries and sick days. 2. Your heart gets healthier. You may think that a regular glass of red wine or other alcoholic drink might be good for your heart. But that may not be true, or only true for light drinkers less than 1 drink a day. If you have more than that, cutting back or quitting can lower your blood pressure, levels of fats called triglycerides, and your risk of heart failure. 3. Your liver can heal. Your liver's job is to filter out toxins. And alcohol is a toxin to your cells. Heavy drinking, at least 15 drinks for men and 8 or more for women each week, over time can damage the organ and lead to fatty liver, cirrhosis, and other problems. The good news is that your liver can repair itself and even regenerate when you give up alcohol. 4. You may lose weight. A typical beer has about 150 calories, and a serving of wine has about 120. Besides being mostly empty calories, alcohol increases your appetite. It also makes you more impulsive and less likely to resist fries and other menu temptations. So when you steer clear of alcohol, the number on the scale may start to go down. 5. Your relationships may improve. Enjoying alcohol in moderation can boost your mood and help you bond with others. But if you drink alone or have many drinks a day, it can become an unhealthy habit. If you can't control it, it can lead to a condition called alcohol use disorder. Giving up alcohol can help you focus on your relationships, work, and health. It can also ease any depression and anxiety and boost your self-esteem. 6. Your cancer risk may decrease maybe. It's clear that alcohol, and especially heavy drinking, can increase your odds of developing several types of cancer, including those of the esophagus, the tube that carries food, liver, colon, rectum, mouth, throat, and breast. What's less clear is whether quitting can lower your cancer risk, and if so, how long it might take. Some studies suggest potential benefits, but scientists aren't sure. 7. Your sex life may improve. A little alcohol can make couples feel more amorous. But anything more than a drink a day can have the opposite effect, especially if you abuse or are addicted to alcohol. Men may have trouble getting and keeping an erection. Women's sex drive may decrease, and their vaginas may be drier. Cut back on alcohol and see if it sparks your love life. 8. You'll sleep better. Alcohol may help you fall asleep at first, but once you're asleep, it can disrupt your sleep throughout the night. A recent study in alcoholism, clinical and in experimental research found that drinking before bed increased alpha wave patterns in the brain. This is an activity that only happens when your body is awake, leading to fragmented sleep. Try to avoid alcohol, especially in the late afternoon and evening, for a more restful, refreshing, and alert feeling the next day. 9. You'll get sick less. Even just one episode of heavy drinking can impair your body's ability to fight off germs for up to 24 hours. Over time, heavy drinking can weaken your immune system and your body's ability to heal itself. Limit your drinking so you can better ward off illness. 10. Lower your blood pressure. If you drink heavily and have high blood pressure, you may be able to get your numbers back to normal by doing one simple thing: quitting alcohol. Even cutting back can offer big benefits. Talk to your doctor about your blood pressure readings. 11. Make your brain work better. Alcohol addiction can make it harder to think or remember things. Over time, heavy drinking can cloud your judgment of distance and space, or slow and impair your motor skills. It can even make it difficult for you to read other people's emotions. But if you quit, your brain seems to be able to regain some of these abilities. 12. Eat less at night. Alcohol contains a lot of calories. Drinking heavily increases brain activity in the hypothalamus, which makes your body more sensitive to the smell of food. 13. Brighter skin. Alcohol causes the body to reduce the production of a hormone that helps absorb water, leading to dry skin. Stop using alcohol. The skin will be healthy. Reduce bumps on the cheeks, sides of the nose, dandruff, melasma. 14. Break addiction. If you are a heavy drinker, your body may rebel at first. If you cut off all alcohol, you may break out in cold sweats or have a racing pulse, nausea, vomiting, shaky hands, and intense anxiety. Some people even have seizures or see things that aren't there. Hallucinations. Your doctor or a substance abuse therapist will likely provide guidance and prescribe medications like benzodiazepines or carbamazepine to help you through it. Once again, thank you so much for watching this video, and I'll see you in the next one. Take care, and have a fantastic day.